Now to our special report on teens and plastic surgery. As more and more Americans pursue physical perfection through plastic surgery, teenagers are electing to change their looks in increasing numbers. And Dr. Alan Gold is a member of the American Society for Aesthetic Plastic Surgery. Dr. Gold, have you ever turned somebody away and said, you're doing this for the wrong reasons?
Absolutely. I think it's incumbent on us as responsible surgeons, and both Dr. D'Amico and I are members of each other's respective societies as well. And I think speak for those board-certified plastic surgeons who take the time and effort to interview patients and try to discriminate carefully about those patients that are doing this for an appropriate or inappropriate reason. Whether we're always successful, we try as best we can to evaluate them emotionally, but it's not very different for a teenage patient's evaluation than for an adult patient.
Really? But aren't teenagers so different in terms of their sort of development, in terms of their self-image and who they see themselves as?
Absolutely, and I think that you need to, as illustrated by both of these patients, need to pick those patients who are comfortable with themselves, who are not looking for a quick fix for any lifestyle problems, any relationship problems, but who are looking to do something for a visible and real, not just a perceived issue that you can help them with. And I think while it is crucial to evaluate the teenager's self-image and so on, adults deal with self-image problems as well. If you find a mature patient as a teenager, then they can be as happy with the results of their surgery as any of our adult patients.
I've read articles that allude to a growing trend of girls getting breast augmentation for high school graduation presents. There's something about that sort of skeeves me. Am I crazy?
No, it should upset you, but it is not true, and I'm glad you brought that up. I think that makes good press. It makes good copy, perhaps, for a publicist, for an individual surgeon. But the trends that you mentioned before are not exactly quite accurate. Certainly plastic surgery overall has gone up, and it has increased in popularity. But only 4% of all elective plastic surgical procedures are done in teens, and that's not a different percentage than it has been for perhaps the last 10 years.
So these figures that say it's gone up 48% are...
Well, yes, excuse me, it has gone up in absolute numbers, but actually the percentage of teenagers
Oh, I see. It's more teenagers, but it's more the overall population as well. Well, that's still...
Yes.
Hello?
Well, yes, and the FDA in 2002 placed the stipulation on breast augmentation that it only be done in those patients over 18. So since that's about the age that they graduate high school, that's not unusual then for them waiting after that time period to have the surgery, and that indicates a trend. And it's also not uncommon to have elective surgical procedures done at points of change in your lifestyle.
Right.
High school to college, college to a job, and so forth, when it's reasonable to change those.